Okay, George, are you there? Record it, so if anyone does miss it, or if anyone wants the slides afterwards, it will be available on the school YouTube channel. So I've invited George to talk today because I think it's incredibly important, really for three reasons. One, to get an overview of what else is available in the healthcare sector, and I think there's lots of professions that are often overlooked. Two, a lot of you that are attending this afternoon are thinking about possibly pursuing medicine. And I think lots of medical professions, healthcare professions are there to help and support people. And it's about seeing what else is on offer. And also sort of thirdly, this is about maybe looking at an insurance choice or another option that you've never even considered. George has previously been into school and delivered similar presentations. He absolutely knows what he's talking about. If anyone does have any questions, as we go through, please pop them in the comment box. And at the end of the presentation, if you're not comfortable doing that, George and I will hang on and ask any individual questions. Does that sound okay, George?
Yeah, that sounds absolutely fine.
Right, wonderful. So I'll hand over to you. Thank you very much for giving up your time.
No worries. So, hi guys. As you just heard, my name is George. I'm a student recruitment communications officer from the University of Liverpool, and I'm currently working on a campaign called I See the Difference, which is a campaign which basically tries to raise awareness with young people like yourselves of the many different professions within the health service, specifically 15 which are called the allied health professions. And I'll go into a bit more detail about what they are in a second. Just a quick objective of this webinar and this session. So firstly, to help kind of give you guys a bit of a backup plan if you're applying for medicine, introduce, as I said, these 15 allied health professions, and answer any questions that you might have about them, because I'm certain that many of you will probably never have heard this term before. It's definitely something I never heard the term until I pretty much started this job. So I want to quickly start with, obviously, the benefits of being a doctor. Firstly, it's a profession that's held in really high esteem. If you say that you're a doctor, it's got a bit of weight behind it. And one of the main reasons that I know this is as a doctor. And every time anyone asks, "Oh yeah, what does your sister do?" I say, she's a doctor, and they go, "Wow, you must be so proud." I'm just like, yeah, couldn't be more thrilled for her. You have really high earning potentials as well. So especially as you start advancing and doing more and more in your career, you have the potential to earn quite a good salary. There's really, really clear routes to progression. So pretty much once you started, even in your kind of undergraduate kind of university time, if you want to be a GP or anesthesiologist, it's really clear how you actually go on that route to become it. There will be doctors along the way, there will be people who will be able to help and guide you, and it's really clear. And there are obviously the thing that most people hopefully want to go into medicine and be a doctor for is the fact that you're able to make a difference to people's lives. That is obviously the key message for it. Obviously, it is really, really nice to earn a lot of money, but obviously at the end of the day, it's all about the people that you're trying to help. Obviously, it is really, really important to have that backup plan in place. Obviously, I have no doubt in my mind you guys are absolutely capable of going on to become doctors, but it is incredibly competitive. As an example, about 1 in every 10 students that apply for a degree at a university and medical school will actually get onto a place, so 1 in 10. And you just need to be kind of prepared about thinking, what else would I want to do? Further to this, I'm not sure at what stages you guys are at within your school life. As part of the UCAS process, so this is the process of actually applying to university. If you're applying for a medical school subject or a medicine subject, you can only actually put down 4 choices of universities which offer a medical school. And then you have a 5th choice, which has to be a non-medicine subject. And the reason for that is just for the bulletin above it, it is incredibly competitive. And basically the UCAS company don't want you guys to be without a place at university because of the high levels of competition. So the best way to kind of get a backup plan in place is before you are applying to university, have a think about kind of where you want to be and what kind of areas you want to study. You're doing your research, so you're really, really well informed. There's lots of different kind of areas that you could look into. You could try to have a think about, would you rather study in a lab or would you rather be in a clinical setting? Oh, go away you. And if you would rather be in a clinical setting interacting with patients, then maybe you need to have a subject which is more patient focused than subjects such as biomedical science, which is what I did at university, which is much more laboratory based. So quick introduction to the allied health professions, a real kind of nutshell statement. So these are professionals that diagnose and treat patients. They aren't doctors or nurses, but they still routinely treat patients who are ill or have disabilities or injuries. Many of these professions in their working lives manage their own patient caseloads as well. So the patients that you're seeing, they are your patients. You're the one that are diagnosing them, you're the one that's treating them, and hopefully helping them recover from whatever illness or condition they might have. So I've said this term allied health professions a lot, and I'm aware that probably many of you won't know what these are. There are a couple that you probably will know from these 15. Physiotherapy is quite a well-known one, and paramedics is incredibly well-known. If you don't know what a paramedic is, that's quite a big gap in your knowledge. But that's generally because these professions are quite well-known because they're out and about. You see them quite frequently. Many of these professions are quite hidden, and unless you require their services, then you won't really be aware that they even exist. So why are the allied health professions a good backup? Firstly, you are training to interact and treat patients. You're not being kept in a lab. You're not being tucked away, learn how to basically interact with pipettes and scientific equipment. Speaking from experience, you are interacting with patients from the start. And when it comes to if you want to go on to study medicine as a postgraduate subject, so that would be an accelerated 4-year course, which you're perfectly able to do as after doing an allied health profession subject. You're able to say on your application that you're already well accustomed to interacting with patients and knowing how to speak professionally in a clinical setting. As part of the process for the application, there will usually be an interview as part of applying, and this just gives you that little bit of extra experience as almost kind of a rehearsal. If you wanted to go on to study medicine afterwards, you know kind of what you're expecting. It's not that much of an unknown entity. And with many of these subjects, you also learn a lot about the human anatomy and the human physiology as well. Obviously, this gives you a really, really good foundation to go on for a 4-year course where essentially you go straight into your second year. So you already have that prior biology knowledge, which is essential to make sure you're able to stay up to speed with everything. So there are a number of benefits to being an allied health professional. Firstly is the employability rate. Obviously, there are lots of different professions or university degrees where you can do a degree and you're not ever really guaranteed a job at the end of it. With these professions, on average, across all 15, 90% of the graduates that are from these individual subjects end up working within their respective fields. So if you're looking for a job where you can pretty much almost walk in, or a degree where you can pretty much walk into a job, these are a great one to go. With a number of these, you can also choose to work in the NHS, or you can choose to work privately if you wanted to. And generally, you can also work core daytime hours as well. So that's Monday to Friday, 9 to 5. This allows you to have a lot more control over your work-life balance and means that you have your weekends for yourself, which means you can go out and see your friends and socialise and not have to necessarily worry about nighttime or shift work. That being said, obviously there are some professions that do require shift work and working around the clock. Paramedics is a prime example. People don't just stop having emergencies because you want to see your friends on the weekend. If you are someone who is interested or wouldn't mind shift work, that could be something for you. But if you're really, really not, something to avoid. With these degrees, the United Kingdom is incredibly well regulated, and it's probably one of the most regulated, has the most regulated governing bodies of most countries out there. And because of that, a degree from university. Oh, I'm sorry about this, guys. Hang on, let me just quickly stop this. Okay, brilliant. Sorry about that. So where was it? So yes, UK incredibly well regulated. Because of this, your degree and your qualifications means that you're actually able to travel the world and take up these courses and these professions in loads of countries. So this degree can really take you wherever you want to go. As mentioned, with many of these professions, the patients that you're seeing, they are your patients. So you have a lot more kind of autonomy over your working life. There's loads of chances that you can specialize. Obviously, nobody really wants to ever do the same thing day after day, time after time. It can get really, really repetitive and it can get really boring. So it's really important that you have these areas where you can specialize and really advance and hone your skills into a really specialized area if you want to. The thing that makes these subjects a lot more achievable is depending on which university or which course you're looking at, the entry requirements can range quite a bit from 3 Cs at A level to 2 A's and a B, or equivalent for BTECs or other qualifications. So obviously if you compare this to medicine, which is almost certainly 3 A's everywhere, this becomes a lot more achievable. And really importantly, the return of the NHS grant. So this NHS grant is essentially free money, which is given to students who are studying these courses simply for studying the courses. It's non-repayable, and it is in addition to any student loan entitlement that you may have. So just to put this into a bit of illustration, so these subjects in purple are allied health profession subjects, which are eligible for £5,000 free grant every year that you study. And as I said, this is generally aimed so that you can put this towards maybe housing or for buying books or helping with placements. But if you guys wanted to use this going out and socializing with your friends, nobody's going to have a go at you. This money is for you to spend however you wish. So in addition to this £5,000 grant, these subjects in orange are entitled to an additional £1,000 grant because these are seen as slightly shortage areas and shortage professions. So these are diagnostic radiography, orthotics, podiatry, prosthetics and orthotics, and therapeutic radiography. These are really the professions where, unless you have used their services, they are really hidden and you won't really know that they actually exist. But their role that they play is incredibly vital within the health service. And then finally, another reason is the fact it can offer a very, very competitive salary. At the point which you graduate, you are automatically eligible to start at a Band 5 salary within the NHS. So this is starting at about 24,000, which for a graduate job is pretty good. And if you wanted to stay in the same job, just come in, do your job, go home without specialising or advancing or doing more, within 7 years, you will end up on that upper limit of about 30,000. But as I said, everyone does want to advance and do more. So as you start advancing and improving your skills, you're able to start applying for jobs that are higher up in the band scales. So you've got band 6, which are known as the more kind of advanced specialist practitioners, and that starts at about 30,000, 30 and a half. Then you've got band 7s, which are known as kind of like the team leaders in the NHS. So you start getting into more managerial roles, and that's about 37 and a half to recognise that kind of increased level of working. And then you've got the band 8s, so band 8A to 8D. These are kind of the more kind of mid-level management or senior management roles within the departments. So, for example, if you were a kind of a head of a department, a very large one, you could end up on a band 8D. And then finally, you have band 9. These are, I will admit, a lot more fewer than the ones above. But these are more for example, if you wanted to specialise in surgery through the role in a route for podiatry, so podiatric surgeon. So this is a podiatrist who has specialised in surgery of the feet, and only the feet. You can't start working your way up. You will then be on a salary of about 89,500 up to 103. So don't believe anyone if they ever says you can't earn a good wage working in the NHS unless you're a doctor. It simply isn't true. So what I've done here is start to break down the different professions into different categories to try and kind of demonstrate how they kind of meet different needs within the health service. So you've got some which are more to help people express themselves and the kind of more therapy roles. So you have art, drama and music therapists. So these are all actually postgraduate degrees. So you would do an undergraduate degree in either art, drama or music. And then you would go on to further specialise in a master's degree, learning how to use those skills as a form of therapy for patients. So often you'll work with patients that maybe aren't able to communicate properly, or they might have some form of developmental issue, or they might be unable to kind of put into words some of the issues that they might have experienced previously in their life, leading to some form of inner turmoil. And this is all about trying to help them express that through a variety of different media. So in the case of art therapy, that would be getting the patient to produce some artwork and then talk to the patient about potentially what their artwork might represent about their feelings and try and help them overcome their issues by that route. And that's very similar for music and drama, with drama being more about role play and simulation to help reenact some of the issues they might have had. With speech and language therapy, this is all to do with trying to help improve that communication with patients. So it could be a developmental issue where patients are a selective mute, or they're not at the same communicative level as some of their peers, working with them to try and improve that. This also could be from a more biological standpoint, interacting with patients who might have lost the ability to communicate and they won't be able to regain it. So, for example, conditions such as motor neuron disease, which Stephen Hawking, the renowned professor, had, he was unable to communicate and he would never be able to regain that ability to speak. So he was then set up with a computerized voice and device by the speech and language therapists. Next, we have professions which help patients move around and stay mobile and independent. So firstly, we have dietitians, and these guys are absolute experts of nutrition, and they're all about trying to help patients manage their diet in a really healthy way as best as possible. So it could be from a biological standpoint, where patients might have had a stroke and they're not able to have the correct nutrition through a solid diet. So giving them and prescribing them nutrition supplements such as liquid drinks, which means they're still able to get all of their nutrient contents through these drinks. It could also be helping create meal plans for patients that may not be able to kind of cook for themselves or have no awareness of how to eat healthily. Create these meal plans to make sure they're able to get that correct nutrition. From the mental health perspective, it could also be potentially working with patients that might have eating disorders as well. The difference between a dietitian and a nutritionist, which is a question we get asked quite a lot, is a dietitian has a recognised qualification in dietetics, and this allows them to register with the HCPC. Only dietitians can call themselves dietitians. Anyone can call themselves a nutritionist. Occupational therapists are all about trying to help patients do the things that they love or allow them to remain mobile after any form of injury or accident. So occupational therapists, you can find them in pretty much every walk of life. They like to spread out into lots of different professions and sectors. And they kind of focus on two main areas. So they've got the mental health area and they've got the more physiological and biological area. From the mental health area, it could be working with patients that might have phobias or anxieties and trying to help them overcome that. And it could be trying to set realistic, small targets to try and help them do more and more in their daily life. An example of this could be a patient who has agoraphobia and is afraid of large open spaces, working with them to try and do more and more so they're able to do something simple as go to the corner shop to get a pint of milk, which For most of us on this call, that sounds like absolutely no problem at all, but for these patients, you might as well ask them to climb a mountain. It's as difficult as that for them. From the biological standpoint, it could be dealing with patients who have had a stroke and have lost a lot of mobility, and trying to help with adaptations into their home or work life situations, so they're still able to do everything they used to do, such as get up and down the stairs, being able to use the toilet facilities by themselves so they're independent, which obviously can give a lot of dignity back to patients. And from a workplace perspective, it could be helping advise on adaptations to their working life, so they're able to still do their job without having to risk losing their job as a result of an injury. Orthotics and orthotists I will talk about a bit more in a second, same for prosthetics and orthotics and podiatry, because these are the areas that will offer you that extra £1,000 bursary because of the shortage. We then have osteopaths. So these professions are all about trying to help relieve pain through a series of adjustments and manipulations to the human body and anatomy. You may have seen videos on Facebook about, or Instagram, of people having their necks cracked and their back cracked. These videos I find incredibly satisfying. I know a lot of people find them really, really gross. But this will often be done by an osteopath, and you may generally find that from the way that a patient's holding themselves, or the way the patient's posture is, they can generally tell what's already wrong with the patient before even speaking to them. And through a series of adjustments and manipulations, they'll be able to start relieving the pain that the patients are having, so they're able to be in a much more comfortable posture for them. We then have physiotherapists. So this is all about trying to rehabilitate patients after they've had some form of injury. So as an example, my uncle recently fell over and he broke his arm in 3 places, really, really unfortunately. He's recently had his cast taken off of his arm, and he's now seeing a physiotherapist, albeit over a telephone now because of coronavirus. So he's still able to have his physiotherapy sessions to get that strength back in his arm and in his wrist. So he's still able to do everyday activities such as making himself a cup of tea or toast. A lot of people like to go into physiotherapy because it's quite sporty, and people often choose to specialise in that sports area as well. If you think of Mo Farah and Mo Salah and any other Mo that does sports, their ability to do their job is their ability to be the best. And they will have a team of physiotherapists at hand to basically make sure they're able to perform at their optimum level. And then we have these professions which are more kind of short-term acute treatments. So kind of helping patients in a really short period of time and seeing another patient straight away. So we have diagnostic radiographers. So this is all about using radiation and high-tech equipment as a form of imaging and diagnosis for patients. So what people often think of diagnostic radiographers is X-rays. And they'll just generally think that a diagnostic radiographer will bring you into the X-ray room, take a picture, and then send it through to a doctor for analysis, and that is not at all the case. So a diagnostic radiographer does a lot of the interpretation as well. So in the case of my uncle, when he broke his arm, he would have seen a diagnostic radiographer, had his arm X-rayed, and then they would have annotated on the document areas worth noting, such as 3 fractures in his arm. Shouldn't laugh. But they then send that report through to the doctor, who will then compare the report with other tests that he's ordered to get an overall picture of the patient's health. So they act as a piece of a puzzle to generate this overall view. They also operate tests such as MRIs and CT scans, which allows you to see more soft tissue rather than just skeletons. And this allows you to see things such as fluid buildups in the lungs, which could indicate conditions such as pneumonia. I won't go into too much detail about paramedics. As I said, I think you guys probably know what these are, but obviously they are on the front line of the NHS, prepared for every emergency situation. This is a profession where it requires quite a high amount of resilience, because you do have to be prepared for almost any situation. Next up is operating department practitioners. So this is the last one that I'll go into detail because therapeutic radiography I'll talk about more in a second. So operating department practitioners, or ODPs, these guys are based largely in the surgical theatres of the hospitals, and they kind of act as a runner for many of the surgery cases, and they assist kind of providing a link between the theatre nurses, the anaesthesiologists or anaesthetists, and the surgical staff as well. They are absolute experts of the airways, and in emergency situations such as a patient who's been brought in from a paramedic and is struggling to breathe, they'll often call an operating department practitioner to help basically support this patient's airway for a kind of interim period until they can get more secure support. They work in two kind of large roles, so you can either specialise in anaesthesiology, so this is helping the anaesthetist put the patients to sleep, or they can work on scrub side, which is helping the surgeons perform the surgery, largely counting in the tools and utensils, and then counting them really importantly back out as well. There are a few string of cases where some vessels went in for surgery and they didn't all necessarily come back out, and the patients left a little bit more magnetic than when they first went in. Nowadays that doesn't really happen as much. They're really hot on that, as you can imagine, and this is all kind of coordinated by the operating department practitioners. They're there for the pre-surgery kind of preparation, they're there for the surgery, and then they also support the patient post-surgery as well. So as mentioned, I will talk about therapeutic radiography and these four in a bit more detail now, just to kind of give you a bit more information about the shortage areas. So firstly, what does an orthoptist do? The first thing worth noting is they are not an optician. So often people, when they think orthoptist, they'll rightly guess eyes and then think eyes, optician, right. They do the role of an optician. Not true. An optician is more based on the high street, and their main role is kind of largely looking for whether patients need a prescription or not. And they have started extending the roles, looking at more issues such as glaucoma, but for many issues surrounding problems with the connection between the eye and the brain, or the muscles around the eyes, or any forms of cancers that might be developing in the eye, they will often refer these patients through to either an orthoptist or an ophthalmologist, which is a doctor who specialises in the eyes. So an orthoptist is more clinical. They're based often in hospitals or in the community, and they diagnose and treat problems affecting the eyes and how the brain kind of controls them and their connection to the muscles and the brain. They often see patients who have got double vision. So this is an issue where essentially patients are, as it kind of says in the name, see double, and this is see double which isn't corrected by glasses. Obviously, if people have really blurry vision because they need a prescription, this can be treated easily by glasses, but there are some cases where patients will develop double vision from anything as common as high blood pressure to anything as sinister as a brain tumour. So it's really important that these are looked at and followed up upon to make sure that it's nothing sinister. They'll also look at treating patients who might have a turn in the eye. So this is called a squint, or professionally known as strabismus. This is where patients have a muscle imbalance around their eyes, causing one muscle to be slightly stronger than the muscle on the other side, causing the eye to pull in a different direction rather than looking straight ahead, as most people's eyes do. This can be treated in a variety of different ways. The non-surgical and non-invasive routes include having exercises to try and strengthen the muscles around the eyes, or you can also put something called a prism in your glasses, which essentially bends light and tries and tricks your brain into your eyes are facing forward, even if one eye isn't. Obviously, there are some different types of techniques which are slightly more invasive and are often considered a last resort if they can't be fixed in other ways. And this includes, firstly, Botox. which is administered by an orthoptist. So this is the way that this works is Botox actually paralyzes muscles, which is how it's able to get rid of wrinkles in your forehead. And what you can actually do is if you've got a muscle imbalance around your eye, so say your left muscle is stronger than your right muscle of your eye, you can actually inject the Botox into the stronger muscle, causing both muscles to be equally weak. And that's fine as long as they are equal and it's balanced, because that means their eyes will be able to face forward and their eyes will be able to work together. Often when patients have got an eye turn, it can also lead to another condition called a lazy eye, professionally known as amblyopia. And this is where basically one eye, the connection to the brain, the nerve cells, they just haven't developed as well as they should have. And this is causing low or poor vision in one of the eyes. And your brain knows that it can see out of one eye and it's happy with that. So it just doesn't work the development of the nerve cells that connect the eye to the brain. However, this means that you don't have something called depth perception. So this is your ability to see how or judge how far objects are away from each other. And this can make things like pouring liquid from a jug into a cup very difficult, or later on in life, parking can become difficult as well. Being able to judge the distance from car to car, leading to increased rate of accidents. So what you can actually do is you may have noticed small children walking around with them. You may have had one yourself. You can actually prescribe an eye patch. So this is a patch which covers the strong eye of the patient, forcing the weaker eye to actually work harder. And the brain then realizes, oh, I can no longer see. We should do something about this. And it then stimulates the growth of the nerve cells, improving that connection between the eye and the brain, allowing for increased amount of vision in the eye. It's really, really important that this is caught early on, because after the age of 8, there's not much that can actually be done about a lazy eye, and this can then go on to affect patients for the rest of their lives. A prime example of that is actually my mum. She has a lazy eye. It was never caught when she was a child, and we found out that she actually had this when we went to go see Pirates of the Caribbean 2 in 3D. And my poor mum, poor Johnny Depp, was blurry for her throughout the whole movie. So she was unable to see in 3D. So yeah, as mentioned, they do work in largely GP-style clinics. They'll see the patient, they'll diagnose them with the issue, they'll create a treatment plan, and then they'll work through that treatment plan with the patients, often seeing patients on repeat visits as well, so you get to know your patients quite well. The next one I'm going to talk about a bit more in detail is podiatry. So podiatry is all about making sure that patients' lower limbs, so lower legs, ankles and feet, are working as well as they can, so patients are able to get around without pain. There's loads of ways that you can specialise into different areas. So, for example, going into sports, podiatry, or diabetes or arthritis. You can also specialise in forensics as well if you want to. There is that little niche as well in that area. And as mentioned at the beginning of the talk, you could also specialise as a podiatric surgeon as well and perform surgery on patients' feet. They help with a number of different long-term conditions. So, as I mentioned, diabetes is an area that podiatrists often specialise. And with diabetes, it's really, really important that you have these allied health professionals working with doctors and nurses, because the further you get away from your core, the poorer your circulation gets. And obviously, your feet are quite far away from your core, meaning that they get far less blood than they should, which means they get a lot less immune response to their feet. So their white blood cells just aren't able to get down to the lower limbs to provide the feet with that kind of immune protection, which means if they get any infections in their feet that are left untreated, that can then result in a really bad infection, which, if left untreated for too long, can lead to amputation, which is obviously the last thing any practitioner would want for their patient, and it's obviously definitely the last thing any patient would want. It would have a giant knock-on effect to their kind of independence. It would have a massive impact on their mental health. So it's really important that it's never able to get to that stage where it can lead to something so drastic or severe. Just a quick fact, in the average person's lifetime, the average person will walk about 150,000 steps. So it's really, really important that you have these professionals to look after your feet because, as you can imagine, towards the end of your life or midway through your life, your feet won't be looking as fresh as they did when you were first born. And I like to imagine the human body kind of like a house. If you don't take care of the foundations, or if you have poor foundations, this is going to start working its way up the body and creating problems up above. So if you can make sure that the foundations stay strong, hopefully this will prevent issues developing above. The next profession I'm going to talk about is prosthetics and orthotics. So this is actually one degree, so you would do a degree in prosthetics and orthotics. There's only actually one university in England that offers this course, and that's the University of Salford. And this course trains you to go into two professions, either as a prosthetist or an orthotist. So a prosthetist is someone who creates artificial structures to replace a limb. So this is called a prosthesis, like this gentleman has being fitted onto his leg. Or an orthotist creates artificial structures to support a limb, kind of like a scaffold or a splint. So this is called an orthosis. These devices are often made to fit. They are unique to each patient. So the prosthetist or orthotist will take a mold of the patient's anatomy and then make a device that is custom to them. Very rarely will you find an orthotist or prosthetist taking something off the shelf. And as you can imagine, throughout your life, whichever device that you have won't necessarily be suitable at each stage. If you have had an accident as a child, or you had a developmental issue where you didn't your limbs didn't develop properly, obviously it stands to reason that any form of prosthesis or orthosis that you have as a child won't be fit for purpose as you get older. Similarly, if you grow a bit or shrink a bit, then the custom fit won't necessarily be as accurate as it could be, so you'd have to see repeat visits to the patient, to your practitioner. Because of this, the bonds that you generally find between prosthetics and prosthetists and orthotists and their patients are often quite strong because you'll be using their services for quite a while. The next profession, or the last profession that I'll talk about in detail, is therapeutic radiography, or therapeutic radiographers. So these are professionals that use really high-tech pieces of equipment like the one on the screen. It's called a LINAC, to basically target and destroy cancer cells or other different types of cells that maybe are overactive, basically causing the cancer cells to die and hopefully allowing the patients to recover from their conditions. And the way this works is, so the reason cancer is able to grow so out of control and form a tumour is because a mutation will be introduced into a healthy cell, which basically causes the healthy cell to lose its ability to regulate its own growth, where usually a healthy cell would go, okay, grow, 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 die. The healthy cell loses that, or the cell loses that ability, and it just goes grow, 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 grow uncontrollably until it forms a mass or a tumour, which can then start causing harm to the patient. In addition to the ability to regulate its own cell growth, it also loses its ability to actually repair any of its DNA, and this allows it to still continue growing. But it also means that any mutations that are introduced later on can't be fixed. And if enough mutations are introduced, it then loses its ability to grow, and it becomes pretty much stationary. And that's what this technology does. It really precisely introduces a dose of radiation to this tumour and these cancer cells, introducing loads of new mutations into the tumour and the cancer cells, stopping them from being able to even grow, which means that either through surgery or through the immune system, depending on how effective it is or how large it is, it should then hopefully be able to remove this cancer or this tumour. Which obviously means that this will allow patients to then go on and live much longer, happy, healthier lives. Obviously, in some cases, it's not possible to treat all patients through radiotherapy treatment. But what this can do is prolong the life that they might have, allowing them to have more time with their loved ones. Obviously, this does require quite a high amount of resilience in this profession, as of the types of patients that you're dealing with. However, it is incredibly rewarding because this is a profession where you really can save lives and try and help extend patients' lives. So it can be incredibly worthwhile. With this profession, you can choose to specialize in lots of different areas. So you could go into the more medical physics, looking at doing research to create new types of software or development. Again, that can also follow through to a route of IT and specialism, helping create programs and software to run these types of equipment. And often you'll find that a lot of these professions choose to go into management as well. It is worth noting that you're not always just treating cancer patients, and this technique can be used, and this type of treatment can be used for a variety of other conditions as well, such as an overactive thyroid gland or overactive glands, which are producing too much hormone, which might cause negative effects on patients' lives, basically reducing the amount that the hormone gland starts working, so that way it then reduces down to a level which is starts producing an output of hormone at a good level. So what I wanted to do was to kind of create a patient journey for you, just so you have an awareness of how these kind of professions all link, and how when a patient, especially in an emergency situation, they don't just see a doctor or a nurse, they'll be seeing a whole host of clinical professionals. This doesn't even include the non-medical staff such as porters, secretaries, medical receptionists as well. So a 55-year-old patient was admitted to A&E by the paramedics with a suspected stroke. So following a CT scan by a diagnostic radiographer, they discovered that a brain tumour was actually the cause of the stroke. So the brain tumour was blocking off some of the blood vessels in the brain, stopping the brain from getting the essential oxygen that it needs to function, which means that the patient's brain then resulted in a stroke. So the patient went in for emergency surgery where the operating department practitioner assisted. And then following this, the patient also required radiotherapy treatment just to remove any residual tumour. As a result of this stroke, the patient also developed a distinct eye movement. So they were then seen by the orthoptist to strengthen the eyes and reduce this double vision. It's actually really interesting. Orthoptists can choose to specialise in stroke, and you can actually tell where in the brain the stroke occurred by the type of movement the eye is displaying. So it's actually really, really cool. Sorry, quick drink. As a result of the brain tumour, the patient also developed a condition called drop foot. This is where the connection between the brain and the muscles in the foot isn't as strong as it should be, and the patient can no longer support their own weight on their foot or on their leg. So they were then seen by an orthotist to produce this orthotic to support the patient's movement. So it's basically a strap which straps around the leg and supports this movement. While this did enable them to get around unaided without need of a wheelchair, it did change the way that they walked. And the way you walk is called your gait. So throughout their recovery, they then had to see a podiatrist to try and treat the calluses that developed on their feet, which was causing them a bit of pain and discomfort. And throughout the whole recovery, the patients would have had regular visits from occupational therapists, speech and language therapists, physiotherapists as well, to help with their rehabilitation and their movement, and also see a dietitian as well to make sure they can get their correct nutrition. So really quickly, I'll talk about the routes into these different professions because I'm aware of the time. So the main route into these professions is largely through an undergraduate degree at university. With these are largely three-year degrees, and as part of that, the placements are included as part of the 3 years. So once you graduate, you don't need to do a form of pre-registration year or an internship. You're able to go straight in as a practitioner. There are some postgraduate routes available to you. So if you wanted to go in for a kind of 2-year accelerated course after a second degree, that is an option. For art, drama, and music therapy, as I mentioned earlier today, the only route in is through postgraduate study. And then another option, which is slightly more new and up and coming, it's not largely available just yet for most of these professions, but there are degree apprenticeships available as well. So this is where the NHS will essentially pay for your degree at university, where you do more work on the job and then some study as well based at the university. As I said, these are very, very new and in development. There are some that are a bit more up and running. For more information on that, recommend looking at apprenticeships.gov.uk. So at the beginning of this talk, I talked about the benefits of being a doctor or going through medicine, and I thought it would be quite good to talk about the benefits of being an AHP. You'll notice that they are exactly the same. If these are the reasons why you want to go on to be a doctor, they are just reasons to go on to be an allied health professional as well. Especially now, these professions are held in huge esteem, with obviously the claps at 8 p.m. every Thursday. Never before has the NHS had as much recognition as it has now. As mentioned, you can still have really high earning potentials. There are real clear routes of progression. There will be signposting and help for you to know how you can go through your rates of progression and specialising. And as I said at the beginning, most importantly, these are professions where you can make a difference to people's lives. If you want to find out more, you can always go to our website, which is iseethedifference.co.uk. I think we've got a second slide actually. Yep, iseethedifference.co.uk. Stepping to the NHS has a fantastic resource where you can actually do a quiz to find out what kind of area you might be suited for within the NHS. I took it and they said I would be well suited for public facing, potentially outreach, which is pretty good because that's what I do. And you can also check out our social media as well, which is iseethedifference or at iseethedifference. So if you have any questions, I would welcome them now.
Thank you very much, George. That was incredibly informative, and I'm always surprised, even though I've heard this before, about how many different areas there are and what all those people within the NHS do beyond sort of a doctor and a nurse role. Students, thank you very much for attending this afternoon. If you do have any questions, George and I will hang around for the next couple of minutes to answer those. If not, have a lovely afternoon and thank you for attending. Thank